Today we are going to study about esotropia. Esotropia, deviation from two Greek words, eso which means inward and tropo means turned. Pseudo-esotropia, apparent convergence skewed, angle kappa negative, causes telecanthus and epicanthus. And this is the diagram is showing for A is positive angle kappa, no strabismus, and diagram B is showing is micro strabismus, and angle C is showing is negative angle kappa is no strabismus. And next one is symmetrical corneal reflection, epicanthus is no strabismus. The three infants are given below are a symmetrical corneal reflection epicanthus. Asymmetrical corneal reflection, Hesberg's test, showing the image. This is the image of first one. The image A is showing a symmetrical center, and asymmetrical are pupillary margin as 50 degree angle, and C is showing is close to limbus is 30 degree and below to limbus is 45 degree. The three common recognition stage is esophoria, intermediate esotropia, and esotropia. First one, three components are esophoria and intermediate esotropia and esotropia. First one is esophoria. The eyes are straight, maintained in a position by fusion. Second image is showing that the position of eye under the cover is esophoria. Under covering, the right eye has deviated inverted. Upon the removal of covering, the right eye will immediately resume its straight ahead the portions. So, first one, in esophoria, the eyes are seen at a primary position. But while we are looking the cover test or alternative cover test, we can see that the eye is deviated into the inward turning of eye. An intermediate esotropia, deviation that is intermediately controlled by the fusion mechanism, manifests under the certain conditions such as fatigue, illness, and stress. Next one is esotropia, deviation that is not controlled by the fusional mechanism, so that deviation is constant. Next one, deviation is divided into two types, inconvenient and concomitant esotropia. First one, inconvenient, is divided into three types, is paralytic, resistive, and aplastic. First one is paralytic, is neurogenic and myogenic. Resistive is muscles, facial and others, and spastic. In unconvenient is divided into three types, accommodative, paralytic, accommodative, and non-accommodative. Accommodative means are divided into two types, is refractive and non-refractive, and paralytic accommodation is nothing is developed, and non-accommodative is divided into essential, infantile, essential, acute, concomitant, microtropia, cyclic esotropia, sensory esotropia, nystagmus blockage syndrome. First one is concomitant esotropia. Accommodative esotropia is deviation due to excessive conversion associated with the accommodation are called accommodative esotropia. Accommodative esotropia is divided into three types, refractive, non-refractive, and paralytic accommodative. First one, clinical presentation, most considering future variable angle of deviation which increase with the effort of accommodation. First one, refractive, normal accommodative esotropia, uncorrected hypermetropia. To see clear at distance, they accommodate deviation for distance fixation. Normal AZ by A ratios are therefore ET same for the distance and near within the 50 PD. No convergence excess responds well to full Cycloplegic corrections of hyperopia. Usually mild and moderate hyperopia is +2 to +6 diopter. Very high hyperopia is does not accommodate bilateral amblyopia. A part for ET and amblyopia they may present with asthenopic due to constant accommodative effect. And is given his case, a 4-year male child, sudden onset right esotropia, mother would like to have a skin correction. Hesberg is 50-degree esotropia in OD. Cover and uncover test 30 cm, moderate esotropia OD, and cover and uncover test 6M is small esotropia OD. Cardinal position of gaze is full, and alternative prism and converted is 30 cm is 36 is 80. Alternative prism and converted 6 is meter is 8 in ET, and VOD is vision in OD is 6/6 and vision in OS is 6/6. Cycloplegic refraction is OD is +52 plus OS is +3.50. Glasses are OD spherical is +3 and OS is +3 in spherical. Hesberg test is symmetrical corneal reflection. Stereopsis is 60 arc-second. Cover and uncover test CC is 30 cm, smaller esotropia. Cover and uncover test CC is 6M for orthophoria. Diagnose fully accommodative esotropia in OD. Okay, AC/A ratio is heterophoria method. AC/A is IPD plus angle N plus angle D divided by 3. Normal 5 to 7 is normal. 5 PD is 1 diopter. Gradient method. AC/A ratio is N minus D by 3. Normal is 3 to 5 PD per 1 diopter. Refractive hyperaccommodative esotropia is ET for distance and convergence excess is greater than 50 PD. ET for near at 33 cm. High AC/A ratio. And non-refractive accommodative esotropia, no cyclic significant hyperopia, no accommodative for distance and no ET for distance. Highly AC/A ratio is greater than 50 PD. ET for near hyperaccommodative types. Hypoaccommodative esotropia, weak accommodative mechanism, over accommodation, normal AC/A ratio, convergence excess types, remote NPA and NPC, whereas hyperaccommodation types have a normal NPA. See in near hyperopia or case under the mild cycloplegia. Age of onset is 2 years of life. Variable angles of ET, presence of convergence excess and fully cycloplegic error should be looked for. Management: full cycloplegic correction if convergence excess is bifocal or are prescribed. The minimal plus added that corrected convergence excess ET is added. And full cycloplegic correction is bifocal, residual esotropia and non-accommodative element, and paralytic accommodation requires surgical for a non-accommodative part. MR resection will with or without retroequality myoplex faded. Just thank you.